Medicare is a federal insurance program that is paid for out of our Social Security retirement benefits. So any person over the age of 65 or anyone who is fully disabled is eligible for Medicare, which has Part A and Part B. And whether you have pre-existing conditions or not, you're eligible for that if you are receiving Social Security retirement and over age 65, or you are 100% disabled and have been disabled for 2 years or more, and then you're eligible for Medicare. It is something, though, that does not pay 100% of your medical bills. It doesn't cover everything, and there are co-pays. That's why most people have to have a Medicare supplement to go with it. Medi-Cal is a program, an entitlement program that we have funded with our state and federal income taxes that pay for the insurance needs, usually for those who are impoverished. But it is also a wonderful program that will pay for people who are experiencing catastrophic illnesses and age-related situations as well. Medi-Cal covers many different things. It covers medical expenses as well as long-term care expenses associated with nursing homes. So in our situation, we would only want to talk about how Medi-Cal could help someone when they're faced with the expenses of extended care that are associated with aging or age-related illnesses, such as going into a nursing home. The 30-month look back as far as Medi-Cal, the state of California's Medi-Cal program, means that at the date of applying for Medi-Cal, the state has the right and the authority to ask a person what they've done with their money or their assets from the date of application back to the previous 30 months. And the reason why they're doing that is because they want to see if you spent your money or gave your money away that would create a period of ineligibility. So we're very aware of how to make sure that we're not creating any kind of period of ineligibility, even though we may be moving assets around within the California and federal guidelines. Well, spend down is a term that's used in Medi-Cal speak to reduce a person's assets in order to satisfy the resource allowance for the Medi-Cal eligibility and to be able to meet that program's specific resource allowance for a married couple or a single person, and be able to receive the Medi-Cal benefit without creating a period of ineligibility. So there are many different ways to do that within the Medi-Cal guidelines. Well, Medi-Cal payback or Medi-Cal recovery is a term that is used for paying back Medi-Cal or the state any money that they've spent on someone for their care. So unfortunately, even though we have contributed our state and federal taxes to fund the Medi-Cal program, when we get or qualify for Medi-Cal, we're not being given that money. It's actually just being loaned to us so that we have to pay it back. So that at the date of death, if a person has enjoyed the Medi-Cal benefit in their lifetime from age 55 and over, the Medi-Cal is going to ask for that money back depending on what is in their name and what assets they have at the date of death or the date of death of the last surviving spouse. So it's really important to make sure that we do not have any assets in a Medi-Cal recipient's name at the date of death. You can apply for your own if you meet the Medi-Cal requirements, and that is for a single person you can only have one home, one car, and no more than $2,000 in your name with whether it's cash, checking account, savings, CDs, investments. For a married couple, if you have one spouse that's in a nursing home and needs help, and the other spouse is what we call the healthy spouse, then the healthy spouse is going to have to meet the requirement as well, which means that they can have a home and a car and no more than $115,000 in additional assets. The spouse that's going to be using or utilizing the Medi-Cal benefit because they're in a nursing home can only have $2,000 in their name, and that is all they can have. So it's very easy to get Medi-Cal if you fall within those resource allowances. However, the tricky part is that not all eligibility workers are aware of the code regulations, and if you're over that resource allowance, it's very difficult to know what the Medi-Cal rules and regulations are.